I'm worried that my son may have autism. This is from a mom that suggested during one of our consultations that her 2-year-old was struggling with developmental milestones of head control, low tone, speech, and socialization, along with immune system compromises and behavioral struggles. She was beyond frustrated trying therapies and medications from specialist after specialist after specialist and still not seeing real improvements. You could feel that this mom was committed to finding answers, but at the same time that she was scared. What are these symptoms adding up to? Do I have to worry more about my child? How do I get out of this storm? Like this mom, you may have been told that it's just bad luck or that it's genetics, leaving you feeling helpless. But what if we told you that there's now strong scientific evidence that a cascade of events beginning even before birth could be affecting your child's developmental growth? These events are surprisingly common, yet often dismissed as harmless by our pediatricians and OBs. In this video, we're going to walk you through what we term as the perfect storm and how factors accumulating as early as pregnancy and birth set off a sequence impacting nervous system development, draining our immunity, and progressing into chronic conditions that are plaguing so many kids today. Best of all, we're going to share natural solutions that finally get to the root cause for complete, lasting relief. This video is for parents noticing subtle to more pronounced developmental delays or social disconnects in their baby's first 2 years that could potentially signal autism. We'll explain key signs of autism by age range so you understand what to look out for and when. We'll also cover suspected causes like birth trauma and infections that may contribute. Plus, the important role specialists like pediatric chiropractors play in support of this developmental trajectory. While no two children are exactly the same developmentally, when we unpack those delays, like those that are associated with autism or a bigger diagnosis, they often have a sequence of struggles that we can observe. While autism affects communication, behavior, and socialization, the sequence of that struggle starts earlier on. While genetics play a role, environmental factors like maternal infections, prematurity, medications, and birth trauma involving oxygen deprivation or damage to the brainstem and upper neck are also contributed. And all of this adds up into the perfect storm of stressors, and the central nervous system development, the signaling, integration are most affected. And this is why everything, while diagnosed differently, is so intricately connected. Add up all the perfect storm of stressors, and the central nervous system development, signaling, and integration are most greatly affected. And this is exactly why everything, while diagnosed differently, is so intricately interconnected. This is why it's so critical to identify autism early and optimize life quality, function, and the developmental trajectory. Here are some of the developmental signs to look for early on. Signs appear as early as 3 months if babies don't reach milestones like eye contact and grasping objects, bringing their hands to their mouth. Additional red flags at 7 months if not turning towards sounds and laughing or engaging. By 9 months, not responding to names, copying gestures, or looking where others point could indicate autism. More pronounced symptoms from 12 to 24 months if no speech, gesture, standing, or severe sensory sensitivities can be present. Some pediatricians can dismiss delays, but early intervention provides the best outcomes, often through these therapies. So where can neurologically focused pediatric chiropractic care help? The answer to this question is honestly incredibly simple. It's simple because it all begins with our focus on that main, wildly important operating system. And that's the autonomic nervous system and our vagus nerve. As pediatric experienced trained doctors, we know that there's no cure or treatment for autism, which is exactly why we don't even say that we treat it. We simply and safely work to restore balance to our autonomic nervous system by proving neuromotor tone, movement, and coordination. If a child has a subluxation, neurostructural shift, and dysautonomia at play, then even if they are getting all of the appropriate therapies like PT and OT, speech, ABA, if they're on a perfect diet, taking supplements and doing detoxes, they'll struggle to see results as long as that nervous system stays in a fight or flight, disorganized, and inefficient state. The storm begins to brew the moment that subluxation sets up shop. The earlier that subluxation and dysautonomia show up, and the worse that it is, the more likely a child will end up with more severe health and developmental challenges like autism. If you have any concerns about your child's development, whether they're subtle disconnects or more pronounced milestones that they haven't reached quite yet, it's important to trust your mom and dad gut and search for hope, answers, and drug-free hope. To discover how we can support children experiencing developmental delays and sensory issues relating to nervous system dysfunction at the neurological level, please click the link below, because our doctors are trained in the nervous system and our team wants nothing less than your child to be able to reach their full potential.